It's often quite difficult for parents to figure out what's the best intervention for their child. How do you prioritize intervention to meet that family's needs or to meet that child's or individual's needs? Interventions for people with autism should be prioritized depending on the child's age, their developmental level, their level of education, and the presence of negative behaviors. If the child is engaging in destructive, aggressive, or potentially dangerous behaviors, the priority should be to reduce those before working on any other skill development. The child will be unable to expand communication if any frustration leads to aggression.
The way that I help families prioritize interventions to meet their needs is to really do a nice interview that helps families think within themselves of what's important to them. We all have our strengths and weaknesses. We all have things that change our quality of life that may be different than other people's. And so for one family, I always think about shoe tying, like it just does not matter. They're not an outdoorsy family. They're not an athletic family. And so it is just really unimportant for them to have a child who can tie their shoes. To me, that's good self-awareness that a family is able to identify that this is a skill that is sort of expected in our society, but it's not important to us. We can move on. We can focus our time and energy on something else.